for coming. What a wonderful crowd we have today. There are a lot of people in the city passionate about healthcare. My name is Sylvia Spence. I'm a community organizer for Indianapolis. I'm supporting Organizing for America and President Obama. I'm really glad to be here today, and welcome to all of you. So a little bit about Organizing for America and the Indianapolis chapter. As I mentioned, we consider ourselves the team on the ground to support the President of the United States, so what an honor. We actually had our first team meeting about a week ago where the President addressed the volunteers of the United States while aboard Air Force One, and we kicked off our healthcare campaign together. And he was really clear that it is his intention and commitment to pass healthcare reform in year 2009, so that is this year. And let me ask a question here, and just to get a sense for who we've got in the audience. How many of you have been impacted by our current healthcare system and the gaps in our healthcare system? If I could just see a show of hands. And how many of you have friends or loved ones that have been impacted by our healthcare system? Show of hands. Even more hands. And finally, how many of you are expecting and committed to ensure that we have affordable health care for all Americans in the country? So that's really our theme today, that's what we have in common today, is that we're all committed to that common purpose. And just to set the tone for today's event, I would ask that we keep that in mind. I know there are many of you who are probably more educated than those of us that are organizing on healthcare policy and on healthcare. What we can say in Organizing for America is we are good at organizing, and I think the results speak for themselves in the election. We may or may not know as much as you do about healthcare. So today's meeting is largely to build our team and to begin taking action, and we want to unite around the common principles that Marlene is going to talk about and that the President has set forth.
I think that's true about health. One of the things I wanted to mention is when we look above and we sort of zoom out and talk about healthcare, it's a lot more than go to the doctor. We know that. I mean, it's a lot more than can I get to the dentist. Healthcare is about the society we build around us. It's about how we care for each other. It's about whether we put a grocery store in your neighborhood. It's about whether we build sidewalks for you to walk on so that you're not having to drive your car. It's really about us and our values. It's a barometer for how we care and love one another. And as a community, we can do a lot better. And so I'm really excited to see all of you here, and I look forward to working with you. And thanks a lot for giving me some time.
So by the time the kids and families get to me, they're pretty sick. Whether or not they are just need to be hospitalized or in the ICU, it's a very stressful situation. Why do they come to me? I'll tell you, almost 9 times out of 10, it's because they haven't had the ability to care for themselves sufficiently to avoid getting to the point where they need me. If a kid has a primary care physician, then they get good care. But it's more than that. Can they afford their medications? Do they understand their medications? Do they know all of the things that will impact their health, from their lifestyle choices to the school choices, to what they ate for breakfast that day? We are tied very often in the hospital. When kids get to us, we think, all right, this is our plan, and this is what we're going to do, and we're going to make them better. And yet we need all of those other resources. So even if I know what the best practice is for that child and that family, I may not be able to follow that through and execute that plan. And that's why it's so important that all of you are here today.
I just want to say that it is so neat to feel all of the energy and the passion that just flows from all of you because of your care and your concern and your desire to help in that reform, to help our president get past what needs to get past. And it is a very fierce urgency to fix this system. And the president very strongly believes that whatever plan we end up with, and we don't know what that end plan will be, but whatever it is, it has to adhere to his 3 core principles. They will work no matter what your passion is or what you feel the answer is. And the first one is reduce rising healthcare costs. reduce it for families, individuals, but also for businesses and for government, so that we can become a nation that is fiscally responsible, but also taking care of our people, so that no one has to say, I'm not going to the doctor, I'm not taking that medicine that I need to stay alive because I can't afford it. The second principle that he has is that we must guarantee and protect people's choice of doctors, hospitals, and health plans. Talked about, the health plan that I have and that I'm very happy with, and we need to be able to protect that. And his third point is that it must assure that we have affordable, quality health care, and those two words are important. Not just affordable, but also quality. And I'm sure there are many stories, even in this room, that can talk about the quality that wasn't there, even though there was health care, and the things that happened because of it. And it's the key to it all. So we know the status quo is unacceptable. We have to stand behind President Obama to ensure that the healthcare reform becomes a reality by the end of the year.
On June 27th, which is 3 weeks from today on Saturday, we're going to have National Healthcare Day of Service. So it's going to be nationwide. All OFA groups and individuals are going to have at their house meetings today or planning for a service event that they're going to host on that day. First of all, the neighbor-to-neighbor contact is going to result in the same networking that we saw during the campaign.